Hey everybody, welcome back to Ortho Nugs. In this video, I'll be demonstrating just a few basic hip joint mobilization techniques. These are some of my favorites. You'll see a combination of both oscillatory and sustained joint mobilization techniques. All right, let's start with a posteriorly directed or anterior to posterior mobilization of the right hip. So first I'm going to find ASIS and then the lateral aspect of the greater trochanter just to get oriented so I can move a bit anterior and medial to the greater trochanter. My direction of force, although it's a posterior mobilization, is more in a posterior lateral direction because of the orientation of the acetabulum. Also notice that we're in the open pack position with the hip in a bit of flexion, abduction, and external rotation. Now we can progress this mobilization technique to put the hip in greater degrees of hip flexion. So we're going to do that same posteriorly directed force, but now we're pushing through the long axis of the femur. I'm oscillating into the barrier. So by positioning the hip in this 90 to 100 degrees of flexion, I'm pre-tensioning the posterior capsule of the hip and then gliding posteriorly and laterally. This technique can be beneficial to increase hip flexion as well as internal rotation. Now I'm going to incorporate the belt with a lateral distraction technique. So I typically ask the patient to position the belt on the proximal medial aspect of the thigh. We, of course, want the belt, the mobilization force, which is being distributed through the belt, to be as close to the joint as possible, as with all of our joint mobilization techniques. I'm applying more of a sustained lateral distraction mobilization force. I can use my left hand to stabilize the pelvis. I'm also using my right hand to create a counter force on the distal femur to keep his hip from rolling or moving into abduction as I apply that lateral distraction force. Now I'm putting the hip in greater degrees of hip flexion yet. So pre-tensioning the posterior capsule as I apply that laterally directed distraction force. I can bring him in, do a little bit more adduction, also incorporate some internal rotation at the hip. And again, it's a way to progress this mobilization technique or add slightly more tension to the capsule before applying that lateral distraction mobilization force. If patient discomfort is an issue, we can also add a towel. So again, I ask the patient to position that towel on the proximal thigh and then the belt. Applying that same lateral distraction force, first with his foot on the table and then bringing his hip into a bit more hip flexion. This is another technique that I really like. This is more of a caudal or inferior distraction technique. So we're going to place the mobilization belt on the proximal anterior aspect of the thigh now. We'll bring the hip into flexion. I'm resting his foot on my shoulder, just creating a counterforce, stabilization counterforce with my left hand as I apply an inferior or caudal directed distraction mobilization force with the belt. Thanks for watching. Hopefully you found this video to be useful and informative. If you did, then please consider subscribing to our channel. I've also included links to a few additional playlists here that contain some previous hip assessment videos that we've created in the past. Thanks again for watching.